Governor Ron.
The system that we put in place in our state was something we worked out with the labor community, the healthcare community, business, and the citizens of the nation. We came together. It was voted by a 200-person legislature. Only 2 voted no. Our system has a lot of flaws, a lot of things I do differently, has a lot of benefits. The people of the state like it by about 3 to 1. We consider it very different than Obamacare. If I were president, day one, I will take action to repeal Obamacare. It's bad medicine. It's bad economy. I'll repeal it. And I believe the people of each state should be able to craft programs that they feel are best for their people. I think ours is working pretty well. If I were governor, it would work a heck of a lot better.
All right, very quickly, go ahead.
What Governor Romney just said is that government-run, top-down medicine is working pretty well in Massachusetts, and he supports it. Now think about what that means going up against Barack Obama, who you're going to claim, well, top-down government-run medicine at the federal level doesn't work and we should repeal it. And he's going to say, wait a minute, Governor. You just said that top-down government-run medicine in Massachusetts works well. Folks, we can't give this issue away in this election. It is about fundamental freedom, whether the United States government or even a state government. You have Amendment 1 here, offered by Scott Plaikin, who, by the way, endorsed me today, and it's going to be on your ballot as to whether there should be a government mandate here in Florida. According to Governor Romney, that's okay. The state does it, that's okay. If the state wants to enforce it, that's okay. Those are not the clear contrasts we need if we're going to defeat Barack Obama and $1 billion.
Let's go to Miami.
I got it.
Very quickly.
Rick, I make enough mistakes in what I say, not for you to add more mistakes to what I say. I didn't say I'm in favor of top-down government-run health care. 92% of the people in my state had insurance before our plan went in place, and nothing changes for them. They own the same private insurance they had before. And for the 8% of people who didn't have insurance, we said to them, if you can afford insurance, buy it yourself. Any one of the plans out there. You can choose any private plan. There's no government plan. And if you don't want to buy insurance, then you have to help pay for the cost of the state picking up your bill, because under federal law, if someone doesn't have insurance, then we have to care for them in the hospitals, give them free care. So we said no more. No more free riders. We're insisting on personal responsibility. Either get the insurance or help pay for your care. And that was the conclusion that we reached.
Does everybody in Massachusetts have a requirement to buy health care?
Everyone has a requirement to either buy health care or pay the state for the cost of providing them free care. Because the idea of people getting something for free when they could afford to care for themselves is something that we decided in our state was not a good idea.
So in Massachusetts, just to understand that, in Massachusetts, everybody is mandated as a condition of breathing in Massachusetts to be able to buy health insurance. And if you don't, you have to pay a fine. What's happened in Massachusetts is people are now paying the fine, because health insurance is so expensive, and you have a pre-existing condition clause in yours, just like Barack Obama. So what's happening in Massachusetts, the people that Governor Romney has said he wanted to go after, the people that were free ridership has gone up 5-fold in Massachusetts. 5 times the rate it was before. Why?
That's total,
because
complete.
I'll be happy to give you the study. 5 times the rate it's gone up. Why? Because people are ready to pay a cheaper fine and then be able to sign up to insurance, which are now guaranteed under RomneyCare, then pay high-cost insurance, which is what's happened as a result of RomneyCare.
First of all, it's not worth getting angry about. Secondly, secondly, 98% of the people have insurance. And so the idea that more people are free riding the system is simply impossible. Half of those people got insurance on their own. Others got help in buying the insurance. Look, I know you don't like the plan that we had. I don't like the Obama plan. His plan cuts Medicare by $500 billion. We didn't, of course, touch anything like that. He raises taxes by $500 billion. We didn't do that. He wasn't interested in the 8% of the people that were uninsured. He was concerned about the 100% of the people of the country. ObamaCare takes over health care for the American people. If I'm president of the United States, I will stop it. And in debating Barack Obama, I will be able to show that I have passion and concern for the people in this country that need health care, like this young woman who asked the question. But I will be able to point out that what he did was wrong. It was bad medicine. It's bad for the economy, and I will repeal it.
Let's move on. Let's move on.
Wolf. What Governor Romney said is just factually incorrect. Your mandate is no different than Barack Obama's mandate. It is the same mandate.
All right.
He takes over,
All right.
you take over 100%, just like he takes over 100%, requires the mandate.
All right.
The same fines that you put in place in Massachusetts are fines that he puts in place in the federal level.
Congressman Paul, who's
Same
right?
program.